Hello, this is Dr. Charles Benjamin Evans, Dr. Ben Evans with Vitality Internal Medicine. I'd like to take the time to make a very brief spot regarding coronavirus, what it is, how you get it, what to do if you do get it, and how to prevent giving it to someone else. Number one, coronavirus, it's a respiratory virus that is contracted, it's passed on by droplets in the air. How do you get these droplets? If someone sneezes, if someone coughs, you inhale said virus, or you touch the surface of something that has said virus. You thereafter touch your face, your nose, your eyes, giving it to yourself. How long does it take to feel the symptoms of coronavirus? There's an incubation period of 5 to 6 days, meaning in 5 to 6 days after you contract the virus, you might start feeling the symptoms. The symptoms can range from fever, feeling flu-like symptoms, to coughing, to chest pain, to trouble breathing. What type of symptoms should prompt you to call your physician or go to the ER? Number one, if you simply feel like you have the flu, if you feel sick, do you need to go to the ER? Do you need to call your doctor? No. Why not? Because there's no known at this time treatment for coronavirus. Treatment is conservative, meaning that treat yourself with fluids, with rest, and generally speaking, in a week to 10 days, you'll feel better. Also, I forgot to say the most important part of the treatment is social distancing and self-isolation. The concern is that younger, healthier patients who get the coronavirus, they'll recover, generally speaking, without problem. The concern is passing the virus on to someone else who might not be so lucky. Your grandparents, someone with lung conditions, someone who has diabetes, someone who's cancer, someone who's on immunocompromised drugs. It's very important to prevent passing this virus on to them, thereby reducing the load on the ER, reducing the load on the medical system in general, and thereby decreasing the mortality of this virus. How to prevent getting this virus? As we mentioned, social distancing, maintaining at least 6 feet distance from the person next to you, avoiding areas with more than 10 people, staying at home as much as possible. As you can see, these measures have been enacted on small and grander scales throughout the country, and these measures are working to help prevent passing on coronavirus. I forgot to mention the number one thing to do is wash your hands. Wash your hands with soap and water at least 20 seconds, sing happy birthday two times, or simply just count to 20 seconds while washing your hands. You can use a Purell, you can use handy wipes, you can use alcohol-based sanitizer, but the best thing to do is to wash your hands. Should you get treated? Should you go to the ER? The only time I feel that you should go to the ER is if, number one, you have trouble breathing, number two, if you have chest pain, number three, if you have a prolonged fever greater than 100, 300, 104 degrees for more than several hours at a time. I recommend that you hightail it to the ER as quick as possible. Those are the symptoms that are very concerning, and it can lead to dire circumstances if you're not seen and treated by a medical professional. I hope that this short spot has helped to alleviate some of your concerns regarding the coronavirus and has helped to direct you on how to prevent getting coronavirus. Should you get tested? Should you go to the ER? Should you call your doctor? And what to do and what symptoms you should take if you do feel symptoms severe enough to require those types of phone calls. Again, this is Dr. Charles Benjamin Evans, Dr. Ben Evans with Vitality Internal Medicine. To read more about the coronavirus, to get more information, please go to my website, my blog at vitalityinternalmedicine.com. That's vitalityinternalmedicine.com.